On behalf of the NIOSH Future of Work Initiative, thank you for joining us today. Our webinar is on the role of economic security in the future of work. My name is Renee Banakrayan. I'll be your moderator. This webinar is being recorded and will be posted to the website early next year. Before we get started, I would like to let all our attendees know that the NIOSH Future of Work Initiative, which was launched in 2019, and its corresponding work group have many ongoing and upcoming activities. The initiative launched its webinar series last year, and 3 webinars a year are hosted, each focused on one of our 9 priority areas. And this is the 6th webinar in the series. You can view the recordings of the previous webinars on the NIOSH Future of Work Initiative website. Also, be sure to join us next year for 3 more webinars, rounding out our priority topics. If you would like to learn more about the series and the initiative, please visit our website. Okay, and so now I will introduce you to, well, a few words about myself and the 2 speakers for today. So I'm the Chief Economist and I direct the Economic Research and Support Office in the Office of the Director at NIOSH. And I also co-manage the NIOSH Healthy Work Design and Worker Wellbeing Cross-Sector Program. I'm also a member of the NIOSH Future of Work Initiative Work Group, and again, I will be your moderator. So our first speaker is going to be Tapas Ray, and our second speaker is going to be Sarika Abi. Tapas is an economist at NIOSH and the assistant coordinator for the NIOSH Healthy Work Design and Wellbeing Program. In addition, he teaches graduate level managerial and health economic courses at Miami University, Oxford. And he's also an outcome research consultant at the Cincinnati Children's Hospital. Tapas has 25 years of interdisciplinary research experience in environmental economics, public health, and social research in developed and developing economies. He completed his PhD in economics from the University of Connecticut, and his Master's of Science from the Delhi School of Economics. His areas of interest include health evaluation, well-being measurement, survey design and analysis, decision analysis, and future of work. And your second speaker today will be Ms. Sarika Abi. Sarika is the Associate Director for the Aspen Institute's Financial Security Program. She leads the work at Benefits 21, which aims to modernize the design and delivery of benefits to ensure financial security and economic dignity for all workers. She has spent nearly 15 years in financial inclusion and financial security work, both internationally and domestically, with expertise in program management, product design, and research and evaluation. Sarika earned her Master of Arts in Public Administration from New York University, and Bachelor of Arts in Economics from the University of California, Berkeley. So with that, Tapas, I'm going to stop sharing my screen and it's going to be off to you.
So thank you and good afternoon, welcome. Thanks, Renee, for the introduction. So it's my pleasure to talk to you on economic security in this 5th NIOSH Future of Work webinar series. And economic security is an important component of worker well-being. So I'm kind of excited to talk on this one. So today, what I'll try to do is basically I'll introduce you to the concept of economic security. And then I will discuss briefly how economic security is connected to the future of work priority areas. So it is one of the priority areas, but then how it is related to the other priority areas. We want to know that we need to acknowledge the pathways between those. I will also talk about how economic security, what is the relationship of economic security to worker well-being. And at the very end, I will take a slight detour and talk about work, the inherent intrinsic value of work, apart from the income generating, apart from promoting economic security, but just the value of work and the contribution of that towards well-being. So conceptually, this economic security is a rather fluid in scope, and a proper appreciation of the term is needed to understand the context of its association with worker well-being. So there is no universally accepted technical definition of measurement or measurement of economic security. Mainly, it talks about adequate income and assets that enable to meet basic needs consistently and safeguard against economic losses and uncertainty. So interestingly, you look at the word consistently and uncertainty, we are in the future, right? So economic security is a forward-looking concept. It's like current and the future. Also very in note here the word assets, and how you define your assets will define the scope of economic security. And we'll see that when Sarika talks about, she talks about the benefits. So economic security, the scope of economic security will be broadened as you are defining assets. Interestingly, I was in Tanzania this summer and I was surveying the Maasai tribesmen. They don't have income, they don't work regularly, but they have assets, and to them, economic security is measured by the number of cows they own, right? So that's kind of an interesting way of thinking of economic security. What I'm trying to say is that how we define assets will broaden the scope of economic security. So given these, if we stick to this definition, like simple definition where economic security talks about adequate income and assets, this is very similar to what we have in the Article 25 of the Universal Declaration of Human Rights, the United Nations, which came up in 1948, right? So it drafts and it talks about how the right to standard of living, right to standard of living, adequate for health and other well-being components. So economic security is more than income. That's what I'm trying to say here. It is a basic right to an adequate living standard. Let's take another example of economic security, defining economic security from the angle of International Labour Organization. So they talk about economic security as like protection against risks of material deprivation, right? And why I'm doing this again is to just conceptually to understand that economic security is rather fluid in scope and a concept that touches upon areas of human rights and not necessarily income, wage, and monetary assets alone. So this definition, the ILO definition, includes, among many things, employment security, right? People who want to work or have replacement earnings in case of unemployment. This is what we usually call job security, but they term it as employment security. Then they have work security, protection against occupational hazards. That's the, like, in other words, workers are guaranteed a safe workplace. And that's what we mostly do in NIOSH, right? To ensure a safe workplace. Then economic security includes representation security, where workers can negotiate on terms of work. And this is important. This is important. Why? Because the concept of competitive wage only materializes when there is bargaining, right? Through bargaining, and the workers have some negotiation power. And by bargaining, we mean a functioning market, a properly functioning market. So economic security also includes market security. A secured market ensures workers have opportunities outside, not only in their workplace, but outside workplace. So if they have job loss, they can always go and find another job. Wage and hours are determined by competitive market forces and not by the scarcity of job or labor. Also important is the concept of real wage, because when we talk about market security and we talk about prices, right, and stable prices, because if you have inflation, if you have a higher price, then basically your purchasing power, the wage is not just the monetary wage value, but the purchasing power of that wage, how much you can buy with that wage. So higher inflation means higher prices, which will bring down the real wage. This brings us to the next category, which talks about income security. So there is a security in income level, income expectation, and income protection. Remember, expectation, that is the future. So that's why economic security is the future of work concept, current and future. And when we talk about income expectation and income protection, we need to talk about skills. So the last component in their model of economic security is job and skill reproduction security. They call it job security, which is different from way we use job security. Our job security, as I mentioned, was like employment security mostly, but this is talking about protection against skill dilution. If you take all this into consideration, we know that economic security now refers to conditions that allow workers to maintain adequate standard of living in foreseeable future And this is exactly what another article of the same United Nations Declaration talks about, Article 23. Everyone has a right to work. Everyone without any discrimination has a right to equal pay. Everyone works has a right to favorable remuneration and unionization and all this stuff. So this tells us that economic security transcends between the realm of economics as a subject and gets into the territories of basic human rights of living, the thematics of human existence as a society. Right? So conceptually, economic security ensures protection against poverty, that's what we are saying, against inequality, and against disempowerment, right? Add to that couple of other things like emotion, satisfaction, which are actually derivatives of economic security, like stress and quality of life, were in the realm of well-being. I will revisit this point later. Let's not talk about well-being now. But before I want to talk about well-being, I would like to take a visit to the Future of Work Initiative, the NIOSH Future of Work Initiative. So this is the NIOSH Future of Work Initiative, priority topic areas. On the left, they have the topic areas. We have the workplace, work, and workforce, right? And they're categorized in these three broad definitions. So we have the workplace, where we talk about organizational design, technological job displacement, work arrangements. We have the work, where we have artificial intelligence, robotics technologies. And then we have the workforce, where demographics, economic security is one of that, and then skills. So what are the relationship of these with economic security as a whole? Let's look at specifically at the, these are all exhaustive, but not mutually exclusive, right? One is connected to another. So let's look at the organizational design, let's look at the work character, workplace topic areas, and look at the ILO definition side by side of economic security. So organizational design will certainly have an effect on work security. That's what we do. We try to find those relationships, highlight those relationships, and also on representation security, right? Similarly, technological job displacement has immediate effect on market security, income security, and employment security. Likewise, work arrangements will have impact on job security and representation security. So all these will have combined effect on the economic security. I'm not talking about positive and negative but relationships, but just the relationship, the existence of that relationship is what that matters to us right now. Similarly, if we go to work, as an example, new technology and robotics not only influence worker safety or security, right? Because we know they are working with newer technology. So this is uncharted territories. So we need to find out their safety implications or security safety implications. Also, it increases productivity, right? Newer technology increases productivity that results in a higher income and income security. This also imposes pressure on employment security because of job displacement and job security, right? Because of the skill updation. So thereby negatively affecting, so again, negative and positive, both are there, and we have to tease out which one is what. Why do we need to study this or know this? Because of sound policy design. So we have to come up with policy prescriptions at the very end, because the negative impacts can be mitigated by proper policy design on social services or training programs that will displace the workers to develop new skills. So all these need a basic understanding of these pathways. Another interesting point to note, not that the individual priority topics influence economic security, but even between the topic areas, there's connections, right? So for example, going back to our previous example, newer technologies can result in higher job displacement and injuring the economic security of worker. But on the same one, like on the other hand, it influences job flexibility, right? And flexibility is one such component which is associated with work arrangements that provide newer opportunities for workers to better manage their lives and outside work, which will be a positive to economy, worker well-being. So similarly, we can talk about workforce, and barring economic security itself, this is one of them, but taking that out, topics like demographics will have their impact on economic security, especially, for an example, an aging workforce requires an efficient social security system in safeguarding the economic security of the aging workers, and so is a skill development, right? So no wonder we have economic security as one of our primary topic areas. Also, we have to understand that among all these other topic areas, economic security is very much related to well-being. The relationship is more pronounced among all these topic areas. The relationship with well-being is more pronounced in economic security, and we'll find that right now. So let's talk about the relationship of economic security and well-being, revisit the well-being concept. So as I mentioned before, economic security is very much intertwined with well-being. For considerable time, let's go to the economics literature a little, take a history view of the history. So the economists define economic well-being in terms of economic security. So for considerable number of years, they were looking at economic well-being as economic security, and that was the measure of well-being. Later, they realized that this is only a part of well-being, which is objective well-being. Right now, they are more appreciating that the well-being is of two components, objective and then subjective. So now well-being, they define as objective and subjective well-being. And so objective well-being is the economic security part. Subjective well-being, they measure by looking at quality of life. And there are ways of measuring quality of life. The easiest way the economists do these days is looking at the evaluative and hedonic well-being. So in a nutshell, well-being as an outcome now is often measured in terms of subjective evaluation of the quality of life. Economic security is one of the components of that. And this is not the economists, but even in CDC, if you go to that well-being concept, that webpage on CDC, they also follow the same logic or same model. We sometimes here in NIOSH, we talk about work-related well-being, and we see it as a construct that includes a host of things like proximal outcomes like stress, and then end outcomes like quality of life or satisfaction. So a perfect example will be to talk about, to look at the well-BQ, the NIOSH well-BQ, which sees well-being as an integral of these domains, the 5 domains: the workplace policies and cultures, workplace environment, work evaluation experience, health status, and then outside work, home, community, and society. So the NIOSH generated well-being is well-BQ is a perfect example of how well-being can be a construct of different things, and again, economic security is one of those components. So for us, it hardly matters whether we consider economic security as a component, here as a component, or as a factor to well-being, because as long as we understand that there is a relationship that exists between economic security and well-being, we are fine, right? So the economic security influences of well-being is evident from some of our studies, and we have been doing these studies for some time now. I would mention a handful of them to highlight the important relationship between economic security and well-being. So, for example, one study looked at unemployment, like unemployment affects worker health and psychological stress. So in terms of recession, you have unemployment that will affect the job demand and job control of the worker, which in Karasek's model psychologically, it will increase psychological stress. So that's one where we look at economic security from the unemployment perspective and the relationship of that with stress, which is a proximal outcome of well-being that we consider. Low wage limits the funds available for food, shelter, self-esteem, and job satisfaction, which again are well-being outcomes. And we see like inadequate wage might be a problem there. I know Sarika will talk about this, but benefits is a huge construct of economic security, right? Like wage, income, the benefits, the assets. Remember, I'm talking about assets. And paid sick leave is one such benefit. And there's a series of papers from ERSO where we look at paid sick leave and the effect of paid sick leave on workers' accessibility of healthcare, workers' accessibility to take time off to recover from injuries or illnesses. And obviously we are out of COVID, so we all know this, like it's a kind of a social distancing thing where you can stop the spread of infections if you have proper sick leave modeled in. Similarly, we look at the work arrangements, how work arrangement again is one of the priority topic areas in our Future of Work initiative, but also it is related to economic security very much because we have seen that some of the work arrangements are precarious and there's less economic security, they are less economically secure. So what are the effect of these work arrangements on healthcare quality of life? We found out, and then obviously flexibility. I was mentioning about flexibility when we are looking at those pathways. happiness. Flexibility at work is associated with health and well-being. We have found that. And finally, we looked at the precarious work, which is associated with job stress and well-being. Among all these economic security concepts that I'm talking about, precarious work is probably the most nearest one, because when we constructed the precarious work scale, or the precarity scale, we did the construct, the components in that scale are very much mapped to the definitions of the ILO definition of economic security, like individual worker rights or so. So it's very much related, and obviously we see that precarious work, economic security, quote unquote, is very much associated with job stress and well-being. So now let's take a little pause here. Till now, I was talking about how economic security is a far-reaching concept, and that work is an important contributor towards economic security. Here, I want to take a little bit off track, and I'll mention a study that I published recently, which talks about well-being influence of work, not from the economic perspective. So basically, work generates income, helps in economic security. I'm not talking about that. It is the intrinsic value of work that can contribute to well-being, and we often overlook that. So this study tells you, like, we measure well-being in terms of evaluative well-being. How we measure evaluative well-being from a scale 0 to 10, people are asked to evaluate their life, current life evaluation. Where would you say you are personally feel you stand at this time from 0 to 10? The higher, the better. Similarly, future life evaluation, where do you think you will stand about 5 years from now? You add those scores together. The higher the score, you are in the thriving area. Middle scores, you are in struggling, and the bottom scores, you are suffering, right? So thriving is better. What we found, looking at the Gallup data, what we found is that people who are working are more and more thriving, right? So work is important. Not only that, people who are satisfied at their job, satisfied at their work, are predominantly more into the thriving zone. Statistically very significant results. So that tells me that job satisfaction is important. Now, obviously, this job satisfaction can't come from the income they are generating. Once we get rid of those effects statistically, like we control for income, we control for other determinants to well-being, like family, work, relationship, the availability of basic amenities outside work. If you control for all those, still we find that job satisfaction is associated with evaluative well-being. How? Like job satisfaction accounted for 14% increase in future evaluative well-being score, in current evaluative well-being, and 8% increase in a future evaluative well-being. So which is very significant. Forget about the evaluative well-being. We looked also at the hedonic well-being concepts, which is basically the emotions, day-to-day emotions of the worker or the person. And after controlling for all other well-being determinants, we found that satisfied workers at work were twice more likely to report happiness, enjoyment, and smile, like those are the positive emotions, and twice less likely to experience negative emotions like anger, stress, or even sadness. So the importance of work, yes, for economic security and beyond economic security, the intrinsic value of work towards well-being, the contribution of work towards well-being is immense. In conclusion, before I pass the baton on to Sarika, who has an interesting presentation on benefits, I believe I just want to round up what we did. It's economic security is an overarching concept, and we need to acknowledge that to understand the pathways and why it is, so that we can justify why economic security is a future of work topic area. And finally, economic security promotes worker well-being, and NIOSH sponsored research continues to explore the relationships. We're still working on this area. So that brings myself to the end of my presentation, and I will just pass on to Sarika. This is my contact details where you can contact, and I'll stop sharing the screen so that Sarika can share her screen.
Thank you, Tapaz. I'm going to dive in, and I'll just say that as I speak, you'll see a lot of overlap with Tapaz's presentation. And so I'm going to provide some of that framing, but really just go deep into some of the work that I'm focused on, which is related to benefits. So the way we think about it at the Aspen Institute Financial Security Program is there's three core pillars of financial security. And you'll see this very much aligns with what we just heard, right? Households need routinely positive cash flow, and that's where their income is typically higher than their expenses, which allows them to meet their basic financial needs and also begin to build short-term savings, which is critical for managing and weathering financial shocks and building financial resilience. Households also need personal resources. These are the savings and financial cushions that allow people to weather those small shocks, as well as build assets and make choices for them and their family in regards to economic opportunity and mobility. And people need benefits, public and private benefits. We know that people can't self-insure all the time, and so they need access to benefits that support them in moments of large economic shocks and uncertainty. And I'll go deeper into what are the specific functions that benefits play for households. As much as households need those three pillars for their financial security, we all know that today workers are living financially precarious lives. This data, I'm going to say, is a little bit old, but I don't think it paints a very different story than what we're seeing today, right? So 53 million workers earn median hourly wages of 10.22. We know that nearly half of households are struggling with income and not enough to meet their expenses, right? And so they're not even in that first bucket where they're able to have positive cash flow. And we know that almost a third of households don't have $400 in cash to manage a financial emergency. And so households are relying on selling and borrowing in order to make ends meet. And we know wages are critical, and everyone needs to have a living wage, but we also know that wages are not enough. So everybody needs benefits to be financially secure. And public and private benefits play a critical role for our households. They supplement income and provide stability. They protect income. They support households in reducing the cost of living expenses, and they help households build financial resilience and wealth. But we also know work and benefit arrangements vary significantly and impact the likelihood of households achieving financial security. So we know that despite the number of public benefit programs and what we've been seeing in the workplace, which is really this proliferation of worker well-being and benefit programs, we know that not all workers have access to the same type or quality of workplace and public benefits. And so what we know is when we look at this, it's really the higher income full-time employees that are receiving workplace benefits that have any chance of really achieving financial security. And we also know that not all full-time workers have access to those workplace benefits. But we know those who are in more precarious work arrangements, who have less attachment to their employer, are struggling a lot, both in being eligible for public benefits, but also in what they have access to and are receiving in the workplace. So what we did, and this was almost a two-year-long research project, but we wanted to really look at a new framework for assessing our public and private benefits. And so what we've done is look at it through the lens of what benefits are supporting households to achieve, like what's the function that benefits play? And then if we look at our current set of benefits, how are they performing in relation to households' financial security? So really outcome-focused assessment of our set of benefits. We look at benefits that are playing these four specific functions: supplementing income and providing stability, protecting income, reducing cost of living, and building financial resilience and wealth. So the value of this to us and the field broadly is understanding what are the core benefits that workers need and understanding where there are levers for change to close existing gaps in benefits, and where there's those opportunities to really modernize our set of public and private benefits to focus on the outcome that matters, which in our mind is the financial security of workers and their families. So in our scorecard, we assess 22 benefits. I won't go too deep into this, but just to say, our study is not all inclusive. We look at the most prevalent and prominent workplace and public benefits. And we don't focus on more emerging benefits where there's not as much data, and we were limited. So we also understand and know that there's other benefits that need to be assessed in this way. But this was a starting point to understand both the framework that we were setting up, but also how benefits are performing for households. These are the benefits that we assessed in this initial scorecard. And so you'll see it's very much a mix of public benefits as well as common workplace benefits. On the workplace side, we focused on paid sick leave. We focused on health insurance, retirement plans, both looking at defined contribution and what we don't see as often, but defined benefit plans, as well as some of the income protection programs, such as workers' compensation. We looked at 4 key indicators when we assessed benefits. And this was really important to us because what you see and what is typically focused on is the access side of benefits. Do households and workers have access to this benefit? But what's not as much focused on is overall the outcome that this benefit has. And that is not just access. It's looking at if they have access, are households using that benefit? Is the benefit providing enough value to the household for it to meet their specific needs? How is the benefit delivered? And are there conditions on the delivery that actually undermine the value and function that the benefit is meant to provide? And we also look at interactions between benefits, which is not frequently looked at, but often, especially when you look across our public and workplace benefits, they're interacting in a way that doesn't enhance, but can undermine the financial security of workers. So asset limits is a good example of that, right? I am disincented to save in an emergency savings or retirement plan at work if it could potentially impact my shorter term stability because it could result in a loss of a public benefit that I'm utilizing. So we look at all of those to then be able to say, how are these benefits performing for households? And what we do is we look at 2 different scores. And again, I won't go deep into this, but these will be available to everyone afterwards, as well as our just broader scorecard publication. But what I'll say is that we looked at 2 different scores when we assessed benefits. One was if we look at benefits and how they're performing for the workers who actually are using it today, what's the score that this benefit receives? So that's really looking at if I'm a worker who's receiving, who has access to and is using retirement, how is that retirement benefit performing for me? And that really looks at the value of the benefit and the delivery functions of the benefit. And then the second score we look at is if we are moving towards this vision of a system of benefits that's inclusive and equitable for all workers, how is it performing for all workers? And so that really looks at, that adds to the initial score and looks at both access as well as interactions, because it matters how these benefits work together to really support households. So I'm going to quickly share this, but we won't go into detail here. But this is the summary of our assessment, and we have 2 pages of them looking at benefits across these 4 functions. And what I'll say at a very high level is what we see as benefits that perform the best are Social Security, retirement, as well as Medicare. And so those 2 are performing the best, partly because of the way that they're designed. They are designed to be more inclusive than many other benefits that are more discretionary in nature. And I'm going to go into kind of 3 of the benefits actually that are very related to the workplace. But I just want to say this was a way for us to be able to see how are they performing. And then what I'll get into is there's specific levers of change under each of these kind of metrics that are critical to understand, because that's where there's opportunity to close some of these gaps. So I'm going to start with paid sick leave. And so I'm just going to go a little bit deep into what resulted in some of the score here, but I'm not going to touch on every component of it. But this is paid sick leave. So overall scorecard performance needs moderate improvement. And a key component of that is that we know that many workers don't even have access to paid sick leave. So nearly 28 million workers don't have paid sick leave through the workplace. And we know that there's features of paid sick leave and the way that it's designed and delivered that impact its ability to support households. So outside of the access piece, we know that, for instance, paid sick leave tends to have waiting periods for workers to be able to utilize it, right? So any delay due to probationary periods means that there's moments of time if a worker is sick, they're either not, they're either showing up at work sick, or what's happening is they're taking unpaid sick time, and that produces volatility in their income, which impacts their ability to meet their short-term and their basic needs. We also know that even when workers have access to this resource, many workers are afraid of job loss or retaliation, or also experience denial, which then impacts their ability to actually use this benefit, right? So having the benefit is great. Workers not being able to use it then really impacts the ability of this benefit to support their financial security. And we also know there's discretion in eligibility, which creates significant disparities in access to benefits. So we know many part-time, low-wage, and small business workers are excluded. And we know nearly 40% of Black workers and more than half of Latinx workers are also excluded from paid sick leave benefits. And so these, again, are features that we look at to assess the benefit, but also there's opportunities for how we reimagine and redesign these benefits to better support workers. And so here's just highlighting a few examples of where we've seen policy and market action that's resulted in improved outcomes. So we know that 14 states, 19 cities, and some counties have mandated paid sick leave. And when it's mandated, we see better access and use of paid sick leave. So in California, 81% of workers report paid sick leave access, opposed to 36% of workers in places without paid sick leave laws. We've also seen some positive behavior in business leaders, where business leaders have adopted and provided paid sick leave to their workers. And so 55% of workers in retail and food service lack access, but more than 80% of workers in Home Depot, Costco, In-N-Out, and Safeway report having paid sick leave. Again, highlighting that there's both policy and market opportunity to close some of these critical gaps. And we saw that during the pandemic, right? These temporary policy actions, which really signal what workers need more long-term, but they were significant in helping close this significant gap that workers have in paid sick leave. Just quickly, I wanted to go through unemployment insurance and workers' comp as well. And I brought these together since they're both critical to protecting income. But both of them, the way that we've assessed them, they need significant improvement in supporting the financial security of workers. And so some of the features to consider when we think about where we need to close some of these critical gaps. One is just the discretionary value of these benefits, which create inadequate and inequitable support. So we know with UI, it's state by state determined, and the wage replacement rate can vary significantly from 30 to 50%. We also see inadequate value for workers when it comes to workers' compensation. So worker compensation covers only 21% of the cost of workplace injuries, with the cost shifting to employees to pay for lost income and medical expenses. We also know there's discretionary access, which creates significant disparities. And so we know with UI, there's a lot of discretionary access across states. Individuals must meet minimum earning levels. And there's a lot of workers that are excluded, those who are not consistently attached, so many gig and contingent workers, as well as those who have been historically discriminated against in the labor market, so workers of color, women, low-wage workers, people with minor disabilities, and even formerly incarcerated individuals. We also know that there's conditions on usage. So similarly to what I talked about in paid sick leave, a lot of low-wage workers are not effectively supported. And many, again, are afraid of retaliation. And so, one study found that only 8% of injured workers filed a claim, and 50% of workers who reported their injury experienced illegal retaliation. One other last point I just want to make is around these kind of interactions, right? So when interactions with benefits aren't designed, when benefits aren't designed to be thinking about the interactions, they could very much be destabilizing or not more holistically support the financial security of workers. So we see just across Social Security, disability, and wages, workers' compensation, the combined amount can't exceed 80% of pre-disability wage, which impacts households' ability to receive more support when needed. Similarly, we've seen some good action that signal what's possible to support workers. New York created the Black Car Fund, which was a way to offer independent drivers access to workers' comp, and again in their industry, and because they are self-employed, would not have typically had access to workers' comp. We've also seen some great progress, especially in the pandemic, as it relates to UI. And when UI was expanded with pandemic unemployment assistance, we saw some innovation take place to make sure that people who were now eligible were receiving those benefits. And overall, again, temporary, but what's possible and the direction we need to head in, we saw really a promotion of equity with UI, with 69% of UI recipients receiving comprehensive wage replacements rates that even exceeded at 100% due to the additional weekly benefit of $600 that workers received in the pandemic. Okay, so just opportunities. Let me just spend a few very quick minutes here. We really laid this out, and you'll see it's fairly high level, and there's a lot of opportunities to go deep. And we left it at this way as this framework because there's many stakeholders that we see are critical to moving forward and closing these gaps and in moving us towards a modernization of our system of public and private benefits. And so we see opportunities for different leaders to engage with the scorecard and go deep in better understanding and assessing benefits through the lens that matters for them, right? There's a role for business leaders and employers in looking at how do we assess our benefits through the lens of financial security? Where are there gaps in what we're offering today? But where is there also opportunity for new benefits to better support our workers? Similarly, policy leaders could be looking at this through the lens of how are benefits performing for residents of our county or residents of our state? How do we compare to other states? And where are there opportunities for us to change some of our design in our system to better support households? This really is just a highlight of where we think a lot of the opportunities are for improving our design and delivery of benefits to close these critical gaps. This is some of what I highlighted in paid sick leave, in unemployment insurance, and in workers' compensation. But it's really these underlying features when we think about benefit access and use, value, delivery, and benefit interactions that are either enhancing financial security or undermining. And so there's real opportunity to think about where are the policy and market solutions here to close some of the gaps and better support workers. And last, I just want to say what we did was not exhaustive, right? And so we continue to see this as a framework to assess the performance of additional benefits, both ones that are current. For instance, we didn't assess life insurance. That's a critical benefit when we think about protection, as well as emerging benefits, such as emergency savings or student loan repayment. Those are emerging benefits we're seeing in the workplace. They provide a critical support for households. And it's important to assess how they're performing to both determine whether they are in fact a critical benefit, but also how we need to strengthen their design and delivery to ensure more inclusive and equitable supports for households. Thank you so much. I'm going to now turn it back to Renee for the Q&A.
So thank you both. Those were very, very rich presentations.
Can I ask you a question? And it's not a question, it's basically I just don't know this area that much, but if you look at till 90s, the productivity, increase in productivity, and if you graph productivity and wage compensation to the worker, they are kind of very similar, like they're aligned. Post 90s, the productivity went up, but the wage compensation went down, and there's a huge gap between the two right now, and the gap is increasing. Now, listening to you, I was thinking like people probably haven't looked, or they might have looked, whether you know that or not. I don't know, is that whether they look at just wage compensation and also the benefits, because I believe the benefit scenario has changed also post 90. And if you adjust for benefits, is it still going up with the productivity, or no, it's still going down? That's what I was.
That's a great question. I don't know. My guess would be that it's probably still going down. I think wages have stayed stagnant, if not declined, and benefits have gotten also kind of worse over time as far as like access and coverage around it. So, but I think that's a great question.
But yeah, that might be an interesting thing to look at. Yep, great.
This is Jay Vitas. I have a question regarding, what are the factors associated with the return from the pandemic has provoked inflationary pressures across the globe? How does that interface with some of the impacts on well-being and sort of how can workplaces address those kinds of issues?
You want to go, or I want to go first?
Go ahead. You can go, and I can.
No, I don't know. Like, so basically, the inflationary pressures are, I think, it's still temporary. How much it is due to the pandemic, like post-pandemic, how much is due to the other macroeconomic variables like war in Europe or so, we don't know. But yes, people are coming back to work. So there was a lot of people who left jobs, and now there's enough people coming back to work. only one section of the working population is still not coming back to work. Maybe it's basically beyond, like in the retiring age, like beyond 60, from 55 to 65, people who left job are not coming back that much. So that might be the concern. But benefit wise, if you have inflation, obviously, if you are depending on your assets, so you are having erosion of your assets. So I don't know whether retirement decisions, whether will be rethought, or like people will rethink about the retirement decisions because of the inflation. I don't know, but benefit wise, I think Sarika might answer better, is that what it implies for the benefits, the rising inflation.
Yeah. So I think, I mean, all I'll add to that is that I think it's creating a lot of challenges, right? Like, I think the reality is people are struggling to just meet basic needs, right? And so they're digging into short-term savings or long-term savings were needed just to manage today, even if it's a temporary situation. I'd say the other side is that employers then are struggling, right? And so we're seeing small businesses, especially more challenged to provide the benefits and the quality of benefits that they want to provide workers because the cost has increased. And so I think it's kind of impacting on both sides. And so again, just opportunity to think about how we think about supports that are more consistent and also more responsive, right? Even as we removed supports from the pandemic, we should have recognized that we're just living in these uncertain, volatile times, that people need ongoing supports, irrespective of the pandemic ending.
Yeah, and something interesting to look at is basically how the wage behaves, like the equilibrium wage, whether it's going up, but how much is the real wage going up if you adjust for the inflation is something we need to research on.